Hello friends, in this video we are going to talk about the Lochia, a very short video. Now, what is Lochia? Lochia is a discharge, is a vaginal discharge following the delivery for next 15 days. Okay. From where it originates? It originates from uterus and not from vagina, especially endometrium. Now, very basic question in someone's mind: why there is Lochia? What is the need for Lochia? So guys, the uterus is there. Just after delivery, the uterus weight is around 1000 gram, that is 1 kg. And when the uterus loses its weight and comes to its pre-pregnancy state, like 100 grams, so where is this volume goes? Where the wall this volume 900 gram goes, it comes in form of fluid, and that fluid is what? Lochia. So it's like melting of uterus, this one. Now for first 1 to 4 days the color is red, so that's why in Latin word is rubra, so it's called Lochia rubra. The 5 to 9 days it becomes yellowish, so it's like a serum, so the name given Lochia serosa. And for the last 5 days it's like white discharge, and the Latin word is Alba, so it's called Lochia alba. Now this discharge is scanty discharge, but what is the importance why we are discussing this thing is it's a very good sign of God that everything is going normal. For example, a healthy logia is a good sign of everything going normal, the uterus going back towards its normal state. But if it becomes malodorous, then we should suspect the infections. If it's like color is changed, very yellowish pus like color, then we should suspect infection. If the duration of Lochia rubra is more, normal is 4 to 5, but yes, if it is a longer duration, then we can suspect the RPOC and subinvolution of the uterus. So this is all about the Lochia. Thank you.